On today's Two on Your Side Town Hall, answers on nursing homes. We will talk with the researcher behind a report looking into how the governor and his administration handled the pandemic.
Plus, after decades of fighting, a day of triumph for two men from Buffalo who just had their murder convictions set aside.
And just how effective have vaccines been in New York? We have the numbers tonight that paint a pretty clear picture.
And we're glad you're here with us. We're going to start tonight's town hall with an important conversation about the thousands of our relatives, friends, and fellow New Yorkers who died from COVID-19 in nursing homes. You've probably heard the controversy surrounding all of this. Tonight, we hope to give you some clarity.
And there is a new report out looking at how the state and Governor Cuomo handled the crisis. We know people in the administration misled the public about the true death toll in nursing homes. The Assembly Judiciary Committee is among those investigating. And now there's a new report out from an Albany think tank. The Empire Center took an in-depth look at the March 2020 order from the state health department that said the following, quote, "No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19.
Critics have argued that caused the virus to spread through those facilities, ultimately causing more deaths. The Empire Center also looked at how the Cuomo administration was, let's say, less than forthcoming when it came to nursing home data. Joining us live right now is the man behind that report. Bill Hammond is Senior Fellow for Health Policy at the Empire Center. Bill, thanks for coming on and helping us understand this.
Hi, pleased to be here.
Yeah, we're glad you're here, and we want to start with the big picture if we can, because we know this is a lengthy report. But what is, if you can, a brief summary of your findings and how the state handled the COVID in nursing homes, especially in those early days?
So you mentioned the March 25th directive. That was really the beginning of what I looked at in the report, which required nursing homes to accept COVID positive patients from hospitals. From the very beginning, the administration described that order in misleading ways. They said false or misleading things about how the order worked. Then, as you mentioned, they withheld the data. They wouldn't tell people how many people were dying in nursing homes. They left out about a third of deaths. They also quoted distorted statistics. They stonewalled the legislature when the legislature tried to act. And then they also fought a Freedom of Information request, which I filed last August. We had to take it to court, and it took us 6 months to finally get the data in February. And I have to say, this wasn't, it began in the heat of the crisis in late March. The order was in effect for 6 weeks, but the misinformation campaign that followed that order went on for months and months and months. In some respects, it's still going on today. We still don't have all of the data that we should have. And it involved not just the governor, kind of spouting off in a press conference. It included a falsified report by the health department. It included many, many statements, which I itemized some of them in the report, from multiple officials, high-ranking officials, including some of the governor's top aides, the chancellor of SUNY, the superintendent of financial services, and of course, the commissioner of health, Howard Zucker.
Bill, months ago, we talked about the impact of that March order on nursing home deaths. Back then, you were critical of politicians like Erie County Comptroller Stefan Mahailu, who said Cuomo's decision for a death sentence was a death sentence for 15,000 seniors. Of course, we know that that's not true, but these numbers represent real lives, and some people have certainly played politics with this. I know it's hard for you to quantify the exact impact, but you have concluded that sending COVID patients into those facilities may have been associated with, an additional few hundred up to 1,000 or more additional deaths. Can you walk us through kind of the math and how you determine that? And what does it mean to be associated with a death?
Well, I don't think, unless you had perfect information, including, a DNA analysis of the exact virus in an exact person, and you'd have to have that for every single person who was in a nursing home. You're never going to be able to say for absolute 100% certain who died why. And we also know that there were multiple ways that the virus could get into nursing homes, including the staff could have carried it in inadvertently, family members could have carried it in, people making deliveries to the homes, and then, of course, another possible source would be these patients who are arriving from hospitals. The way we approached it was we tried to find a statistical correlation between how many patients were transferred to a specific nursing home from a hospital and how many deaths happened at that nursing home in the ensuing weeks. And we did find a statistical correlation. And that's the basis for us saying that it was responsible for some fraction of the deaths. It wasn't the only cause, but it was a cause of what happened in nursing homes.
The Assembly Judiciary Committee that was investigating nursing homes will suspend its impeachment probe, but it will still issue a report. And Speaker Carl Hastie spoke about this, saying investigators did find evidence of, quote, improper and misleading disclosure of the nursing home data. What do you expect will come out of that final report?
Well, I guess I don't know what to expect. I mean, they say they have 500,000 pages of documents specifically related to the nursing home issue. I'm really interested to find out. I guess part of the point of my report is that even without access to privileged information like that, just by looking at the public record and the data that has come out, you can document a lot of wrongdoing. You can document a lot of deception and misleading statistics that were coming, as I say, from the governor and other top state officials for a period of months.
Bill, we're almost out of time, but I do want to point out we reached out to the state health department today for comment. We were totally ignored, so we can't kind of share their side of this. You end the report by talking about recommendations for the incoming governor, Kathy Hochul. Can you give us a brief synopsis of how you think she could help clean this up, for lack of a better phrase?
One of the first recommendations I have is that she should commission an investigation of what happened. Bring in some independent experts, give them subpoena power, and have them really dig into what happened. In fact, I think they should do that for the whole pandemic, not just nursing homes. Another big recommendation is that they should stop playing games with the Freedom of Information law. They should open up their data vault and let everything out, put it on the web. Don't even wait for people to ask, just post it. She certainly should have nothing to hide. It was kind of outrageous that the governor and the health department were allowed to be selective about what they shared, and that really has to come to a stop.
Bill Hammond is the Empire Center's Senior Fellow for Health Policy. We know you put so much work into this, and we so appreciate your perspective and you sharing it with us tonight. Thank you.
Thank you.
Great to see you again, Bill.